Hey, I'm Dr. Keen from Advanced Health and Physical Medicine. Welcome back today. Today we're going to be talking about our spines and the purpose of rehabilitation and maintaining your spines for a lifetime. So to do that, I think we first need to go back and review some of the things we talked about in the past, and that's the importance of the spine. The spine, as you recall, from front to back should be straight. And as long as it is straight, we look here, our ears are level, our shoulders level, our hips are level. We have our 24 vertebrae stacked on top of each other like donuts here. The purpose of that is so when gravity comes up, it stays equal between our hips, between all our vertebrae, all the way up between our ears. Okay? As long as the spine is equal, if you come on a gravity on each side, the spine will function 100%. The disc will work 100%. Okay? From the side, recall that the spine has curves. It looks much different. It has a curve goes forward in the neck, back in the back, and forward in the lower back. And remember, the curves, the purpose of those is to give us strength, to give us flexibility. Those curves they really act as leverage arms to allow us to bend, twist, turn, and move under gravity. If you also notice that part of these curves, there's bones, right? Just like we looked at from front to back. Between these bones are discs. This is what I want to focus on first today. Maintaining these discs are imperative. Our discs, at the age of 12 months old, 12 years old, they actually become avascular, which means that there's no direct blood or nerve supply to them any longer. They require movement to actually have the nutrition to them. The purpose of the disc is imperative to make sure that our spines function in gravity, that our nerve has enough room to flow, so the brain can send messages through it to our body then can get that message, send the message back to the brain. That's how our whole body communicates. So let's take a look at it. Let's take a look at a couple of examples here of what our discs look like, and then talk about what we need to do to maintain them. So here's a plastic spine. Here's our hard bones. Between those hard bones are our discs. And those discs are 88% water and 12% collagen fibers. So you notice behind a good healthy disc, well, there's our nerve coming out. That's how our communication is with our body, from our brain to the body. This is imperative that the disc is healthy. In order for the disc to be healthy, our spine needs to be straight like we talked about, and the spinal curves need to be there. All right? What happens though, if we have injuries that occur and heal wrong in our lives, is that the bones now become shifted. They misalign. And if they misalign now under gravity, the disc stops getting nutrients. And remember, after 12, the disc is avascular, so it has to have movement to be alive. So what happens is, due to loss of motion over time, you can end up with a mild disc degeneration, which can lead to a disc bulge, can lead to moderate disc degeneration. When you notice here, you start to see lipping and spurring occurring, and you see barely a little disc left there. You also notice the hole back here is narrowed, so that nerve cannot get out to the body. Chances are this person is going to start to have some health issues. It might not even be pain yet. Okay? Remember from our past conversations that only 10% of the nerve fibers actually perceive pain. The main job of the nerve fiber is to make sure that your body's functioning, that you're alive. Right now you're not thinking about breathing or heart beating or your liver working, your kidneys. It's all happening because your brain's controlling it. So the little nerve pressure is getting out. Some of those organs aren't going to function 100%. It's imperative that we get that moving again. And by the way, you can get discs like this back to like this through consistent rehabilitation and actual proper treatment of that disc. And then if we don't fix it still at moderate, unfortunately it'll move to severe degeneration over time. And this is when the spine starts to fuse and the nerve starts to die. So we want to do whatever we can to prevent this from happening. And our goal in our office is, once we start to, if you are already moving this way, is to do everything we can and give you the ability, both in the office and at home, to actually take your spine from here and move it back to as close as we can to normal again. So we talked about how the discs need movement. So let's talk about how we rehabilitate the disc. The first thing we do when you have the disc, we're going to work through in the lower back. We're going to work what's called a wobble chair. In the wobble chair, I'll go through a demonstration in just a moment. But it's important to understand that as we go through this motion, it's going to be a movement side to side. And as we move side to side, see this disc here is starting to get motion to it. And as it moves side to side, it's going to push down on this side. It's going to open up and pull nutrition in on this side. As it goes through this side, old blood, old blood, and water goes out this way, and fresh comes in this way. So we're getting nutrition back and forth in that disc. If we go front to back, the same thing's going to work for the disc front to back. As we do an X and a V formation, we're going to basically be taking this disc through its natural range of motion, okay, under gravity, through a movement that you actually do to actually get that nutrition to the disc, so it actually pumps it back, almost like a bicycle pump. And by the way, we have specific pieces of equipment that do this. Exercise ball or that kind of thing won't work, but we have to have something that has a pivot point the size of the nucleus of a disc that can articulate off to load and unload that disc so it works. And done in 15-minute increments, you can actually slowly pump that disc back up. So when we do this, let's take a look at this for a second. If we look at this sponge, imagine this sponge is one of our discs here, okay? And as we do this exercise going side to side, front to back, and then our whole program we're going to go through in just a moment, as it works on getting nutrition to that disc, it's kind of like doing this. If this is our disc, as we go side to side, it's going to push the nutrition out, it's going to suck it back in the opposite side, and it comes here, it sucks it back in, and it's going to go back on the opposite side. It's constantly going to be taking a disc through range of motion, and through called hysteresis, which is loading and unloading on the disc. And as it loads and unloads, it's going to help us bring fresh nutrition in, all nutrition out, and slowly over time, through going through that whole cycle, that disc starts to liven back up, and actually as it starts to liven up, it gets thicker. As it thickens, now we have less pressure on the nerve, better nerve supply, better health. So let's take a look at the wobble chair together. The wobble chair looks like this. And then we have what's called a sissel cushion that people use at home. The wobble chair is designed, it goes side to side, okay? With 15 reps done side to side, 15 reps done front to back. Then we do 15 reps with the X formation or V formation. And then we do 15 reps with a hula hoop, which is to the right, hula hoop to the left. All in all, we're going to go through a series of exercises which is going to help us take our discs in our lower back, doing this to help get proper range of motion and proper nutrition to our discs. I'm going to take you through just a couple of exercises and just to show you a brief example. So here's our side to side. This is typically done, you notice my shoulders are level. I'm not moving my shoulders, I'm using my hips. 15 side to side, 1, 2, 2. Front to back is forward and back. Over here, we're pulling our tummy out, and here we're pulling our tummy in, okay? I inhale here, exhale here. Inhale here, exhale here. As I'm doing this, now I'm taking that disc through this range of motion from front to back. Okay? As I do my X formation here, I'm going right, and I pull straight back. Left, straight back, that's 1 rep. Right, straight back, left, that's 2 reps. Again, we're going to do 15 reps of that. We do our next exercise, which is here. That's our crunch. And here, I'm not moving my body, I'm moving my hips. Here to my right shoulder goes my left knee, right knee, left shoulder, and right shoulder, left knee, right shoulder, left shoulder, good. You get it. What I want you to do is make sure you bring your opposite shoulder to your opposite knee, opposite shoulder, opposite knee. As you do that, we're going to be taking that disc in the lower back and moving more in a V formation to get the rest of that disc. We're going to hula hoop to the right, which is 15 reps to the right, and 15 reps to the left. As we do this consistently, it's going to help us to thicken that disc, reverse degeneration, reverse osteoarthritis, and most importantly, make sure that you're healthy as can be. And by the way, this needs to be done in 15-minute increments. Okay? That's most ideal. 15 to 20 minutes, 2 to 3 times a day, all depending on what your doctor prescribes. Thank you so much, and I hope you learned a lot today about the discs.